Hi, how are you? This is the Mindfully Integrative Show, and this is Damaris Maria Grossman, Integrative Family Nurse Practitioner. And today we have on our mindful chat with Dr. Victoria Chan. She is a naturopathic doctor, and she also is the founder of the Anxiety Banished method. She's really an expert in the mental health space, integrative provider, and she really is kind of an area of anxiety and mental health, which is so important. And mindfully integrated is just one aspect, where she's integrating health in everything that she does as a naturopathic doctor. And as you'll learn more about her. So thank you so much for coming on the show.
Hi, Dr. Damaris. Thank you.
Of course. So tell the listeners a little fun fact about yourself.
Fun fact about myself. A lot of people don't know I've lived in multiple countries before I went to medical school. And I feel that that gave me a really interesting perspective, especially since I study psychology for my undergrad. It was wonderful to get that perspective from so many different cultures from this world.
That yeah, sorry. That makes I'm sorry, hold on. That makes like a lot of sense to me. The fact that you've tried to like use psychology and and in your field. I think that's so important because as a naturopath you're also trying to like talk to people on the regular. So you went into mental health. So kind of tell me a little bit about your journey that got you, obviously I call it integrative health, but it
Mhm.
got you into this health field and becoming a naturopath is medical school.
Yeah, it's a whirlwind of a story.
Well, I mean, you can shut it down, you can make it
Yeah.
smaller, whatever, however much you'd like to share with
Okay,
our
sure. Yeah, I'm someone who loves to be an open book about the story, especially because I do want to speak to the stigma around seeking help and getting help for mental health. So my story was, it started, I think, probably in undergrad or something, where I was having a bunch of different symptoms that I didn't know what was going on. And I actually went to 14 different doctors around the world trying to figure this out. Pretty much it was everything from fatigue to my hair falling out. I got cystic acne, my menses stopped, hormones, like everything under the sun. And people were diagnosing me with so many different conditions. And I kept thinking, how did I suddenly develop all these different things? And it wasn't actually until a naturopathic medical doctor who sat down and was like, okay, let's kind of step back and see if there's an underlying root problem happening. And she was the first one to figure out that like all my mental health and physical symptoms were kind of stemming from different root causes. And she was really targeting that. And that was the
Mhm.
first time I saw like, whoa, you can actually approach things from an integrative level. I was going to specialists that were focusing on one specific body system. But for some reason, I didn't think to look for a doctor who was integrative, who kind of
Right.
was trained in that. So to kind of give another background of all the symptoms, like I was dealing with suicidal tendencies, depression, insomnia, anxiety, disordered eating, memory loss. Like I would have a conversation with someone and 2 hour or 2 days later, like not remember who they were. Like it
Oh
was
my.
like there's so many things going on. And it was amazing that someone could actually look at it from a holistic perspective to figure it out.
Mhm.
So that was the first time I was introduced to naturopathic medicine. And now that I got better and stable and energy came back, I was like, yeah, that's what I want to do. And I went full-fledged into naturopathic medical school because I wanted to be trained in both, not just only the Western medicine, but the Eastern medicine, natural modalities, just have options.
Right, right.
And I tell my patients that it's like having multiple tools in my toolbox. And depending on what a certain person needs, I have different tools to pull out. So I thought that was so beautiful. So I went to that. And then, of course, the stress of medical school and everything going on, I started having daily panic attacks, like landing me in the ER, not knowing what was happening. And I
Mm.
was surrounded by medical resources being in medical school. And it was so hard to figure out. So I decided to do the same thing, kind of step back, look at it from a broad point of view. Really address different root causes, and I overcame it. So it was super empowering for me because I've never had anyone tell me that anxiety could be solved. I always thought you just had to suppress it, just had to deal with it. But the
Mhm.
fact that I'm not taking any pills, whether that's medication or supplements or anything, and I'm totally stable and I have a thriving future, which I didn't think was possible,
Mhm.
I knew that this is what I wanted to do, to just not only give people hope, but to give people resources and just answers that they could use, different tools in their toolbox. So
Yeah,
that's
and
kind of my journey to where I am today.
that's a lot. I mean, that's not
Mhm.
I know you said it's a short version of your journey, but I feel that what you're stating is, you went through kind of two big two big mountains that you've had to
Mhm.
overcome. One was
Mhm.
trying to find a different way of practicing. I definitely went through that as an
Mhm.
integrative NP. I was very much so trying to take care of my health, and I knew that these providers taking all these little pieces of the system instead of putting it as a whole. I was like, this
Mhm.
can't be the right kind of medicine. I can't practice like that. And I agree with you on that. And
Mhm.
then now then taking your wholeheartedness and getting into your anxiety, this anxiety banish method,
Mhm.
and being a mental health provider for so many people that need it, not just because of the pandemic, but as a
Mhm.
whole. I think mental health is your physical, your physical health manifesting, or your mental health manifesting into physical ailments.
Yeah.
um,
Mhm.
to talk about that. And, if you want to go dive further into how you've kind of incorporated that into your work or into your
Mhm.
life.
Yeah, something I had to learn, which took me, in my opinion, way too long to figure out. So what I love telling people is that since a lot of people think that anxiety and mental health conditions are all in their head, and they think that they're not strong enough or not capable enough. But something I really had to learn in naturopathic medical school was anxiety or any other mental health condition is a psychological manifestation of underlying physical imbalances. So a lot of
Mhm.
people, yeah, a lot of people don't know that so many body systems can actually create the same symptom of anxiety, for example. So what I love to do in my Banish anxiety method with my patients in my practice is really investigate and address the different root causes. So things like digestion, people talk about neurotransmitters, but that's just one part of the whole
Right,
picture.
right.
Inflammation, mindset, blood sugar, hormones, thyroid, like there's so many different things. And I think it's a disservice to our health if we don't address each one, or at least just investigate if that's a contributor to our overall anxiety. So I really love targeting those before just throwing something at it, whatever that is, instead of just trying supplements or trying meditation or just pharmaceuticals. I really
Mhm.
try to figure out and pinpoint what those root causes are.
No, that I mean, that's really important because I feel like
Mhm.
there's no one pill fixing anything. and
Uh-huh.
and it's looking at what your patients are. They're probably complex. I mean, even though they
Mhm.
may come into you and be like, I didn't sleep today. I'm like, well, what else is going on, right?
Yeah.
I mean,
Mhm.
I can only imagine how much more they haven't discussed with you or they
Mhm.
need to talk. So
Mhm.
there's the conversations with you must be very in depth, or you probably go very in depth with them.
Mhm. Mhm.
um how have with you don't have to be specific on patient, but with someone in your with your work, have you found, obviously an improvement or a story of something that's kind of helped realize that your method and things with anxiety mental health is an important part.
Almost definitely. A lot of my patients and my clients through my program, a recurring story I hear is I have jumped around from doctor to doctor, from medication to medication, tweaking dosages, looking at things online, but like nothing's really working.
Mhm.
And I just realized that, even things like something benign like supplements. I treat it as pharmaceuticals where the correct dosage, correct timing, correct time of day, the amount that should like what research has shown for that specific supplement to affect different root causes of anxiety has to be taken that way. Not must, but should be known so that you can see if you're following that regimen. But a lot of people don't know that, or a lot of people don't know how to address different root causes. So, when they try whatever that magic pill that they're trying to do, whether it's a pharmaceutical or a supplement, if it's not addressing the root cause, then it makes sense why they're not
It's
seeing
not working.
changes. Yeah, because neurotransmitters aren't. It's the common go-to explanation that we're told just through media or just through regular conversation. We think, oh, we have a chemical imbalance, but that's not the innate genetic predisposition for creating different levels or functioning of neurotransmitters is not the case for most people. And so through my patients, just thinking about how they feel super helpless when they come to me. And after I hear their story, I'm like, you know what? You just weren't given the correct tools yet to address your root
Mm.
causes. Let's let's start there. And I feel that that's so empowering to not only have the hope, but the resources and having those conversations where I feel like in the on the online space, there's so much information, there's so many conflicting opinions, but to have someone who's medically trained both in pharmaceuticals and natural modalities say like, hey, here is the big picture, here's the fluff, here's the noise. Oh, that doesn't really see, just kind of be that medical translator has
Yeah,
really helped. And I feel like just distilling that information has been so transformative for people
I love
a
it.
lot of ways. Mhm.
Have you so just in case the listeners don't know what a naturopathic doctor is, would you be
Hmm.
able to explain that a little further and as yourself as an integrative mental health doctor?
Mhm.
Because you are a medical doctor and you
Mhm.
have an expertise, and I think that more people need to understand your field. And I mean, I think they do, but I would
Mhm.
want them to reach out to you. So would you be able to explain in your words what that is?
Most definitely. I love explaining this because it's not really known. There's a lot of jargon that's thrown around. So one thing I like to start with is there's a difference between a naturopath and a naturopathic doctor. So like you said, a naturopathic doctor goes to medical school, we're medically trained.
Yes.
We do the same courses that traditional medical school will learn, but on top of that, we also learn natural modalities versus
Yes.
naturopath, which a lot of people get interchanged with, just is not regulated, that term. So they can get a
Mhm.
certificate online, and you see a lot of like news articles saying that naturopaths have done harm, but they were not medically trained. So in
Right.
terms of what I do, so I'm a naturopathic medical doctor or naturopathic doctor. Those terms are
Yeah.
interchanged. And so we go to accredited 4-year medical school, and we learn everything from pharmaceuticals to minor surgery to even supplements and herbal medicine and physical medicine. And it's more like I was saying, the natural modalities, which I love. And some
Yeah.
schools even
Yeah.
go into acupuncture, homeopathy, like different
Right.
branches.
Right.
But I love to tell people that it's, like you said, integrative approach to health. So we look at kind of the whole body root causes, but an easy way I like to explain to people is that it's a mix between Eastern and Western medicine. That you kind of delve into both. But at the end of the day, it's like, okay, let's dive back. What's your root causes? How to do the least harm? And for some people, doing the least harm is minor surgery and pharmaceuticals. So some people think that naturopathic doctors are against, drugs and surgery, but for us, it's let's do the least harm. What does that look like? Is that lifestyle? Is that nutrition? What does that look like? So that's how we approach things. And so our typical initial visits tend to be longer. Like you said, it is very in depth. So it's typically 60 to 90 minutes because we go head to toe, like I'm looking for the full thing. But our goal is to eventually have people not have to rely on whatever that we're giving them. So I joke with my patients that my goal is I don't see them again. So it's really to address the root cause for long-term benefits.
I love it. I love how your explanation. I feel that um the doctors nowadays, I mean, insurance reasons, and I'm also in the I like to spend more time with my patients too,
Mhm.
um, depending on the practice, but on my own practice, I definitely love to be more involved. And I think that
Yeah.
more these doctors are not given, and nurse practitioners are in the medical field, the clinics, they're only given like 10 minutes with a patient. How can you learn anything about
Yeah.
someone in 10 minutes? I
Yeah.
don't know how. I can't even digest that, and it's not a quick fix. And I think
Mhm.
people are always thinking quick, and that's not what we're trying to, that's not what this show's about. This show's about trying to see the whole picture, and you're one of those advocates for that. And then especially in the mental health space, do you have a story or just of someone because in mental health you probably have helped so many patients, but that's kind of touched you,
Oh, that's touched me.
that's kind of
Wow.
or inspired you, to
Mhm.
even make sure that because you're doing the right work. I'm going to tell you that 100%.
Thank you.
But what
The first story that's coming to my mind is a recent story of a client through my program, actually, so not a patient.
mhm,
I remember she was so dejected. She was, in medical terms, a geriatric mother. which I hate that term so much, but she really embodied that for herself. And she
Mm,
was thinking like, I can't have kids. I have a business which I think I have to let go because I am so exhausted. My panic attacks are so unpredictable. And it just seemed like everything mental health, but also physical wise was taking over her. And she even told me straight up, like, I don't believe in what you're doing. This is my last straw. I'm really doubtful, but I've tried everything and I'm willing to give it a last shot. And
right.
I felt so honored that I was her last straw. It was a big responsibility, but I was thankful that she was able to give that last push and she trusted me to do that. But I remember just as she was going through my program. So my program is 13 weeks, specifically designed to tackle different root causes of anxiety in a specific order that I've seen to be clinically effective. And she was telling me, like, I probably won't see anything after the 13 weeks, but just after 2 to 3 weeks in, even the little wins that she saw, to me, even though it may be small in the grander scheme, it
Mhm.
gave her so much hope. And
Oh, I love
seeing,
it.
yeah, and seeing that was so beautiful because as sometimes we think in health, oh, we just need to get to the finish line. We need complete eradication of all symptoms, of all pain. But even that little improvement for her, it was just stability of that day. She hasn't had that for so long. And for her to have that, it gave her so much just oomph into just going towards her life and her business and her family that just trickled into so many different areas of her life. Sometimes, when we're so into the weeds of everything, we forget how much it has affected so many different areas of our life. And to just get that little bit of improvement, that little bit of relief can go so far. That ripple effect is something that just, lit my soul on fire seeing that.
Oh, I
Yeah.
love it.
Hmm.
I love hearing those stories because
Hmm.
you know that you're on the right path. You've always been,
Hmm.
but now it's another level.
Hmm.
Um, do you have I don't know, an inspiring quote or anything or a book that you recommend for anyone to read?
Oh, in particular, what type of topic?
Oh, well, I guess in the mental health space, or in the naturopathic space.
Ooh, that's difficult. Let's see.
Oh, there's probably a
One,
bunch.
I
Or what you're
know.
reading now or anything recently that motivates you.
Yeah.
Sometimes I just do like, I'm sometimes it's a podcast for me or someone's
Yeah.
motivating me. I mean, it just depends upon the mood for the day.
Yeah, I'm so into podcasts now, just because it's easy as you're going
Yeah,
through,
yeah. As
your
you're going through
daily
the day.
things.
Yeah.
TED Radio Hour has always been so inspiring for me, and Hidden Brain, those two.
Yeah. Cool.
I particularly love any books or podcasts where it just blows your thinking and just you like what you thought was possible or what you held as a belief as for yourself is just you see a different way. And I feel like TED Radio Hour does that. And
TED Radio
I
Hour.
can't have a specific episode in mind, but I remember each one shows you a different aspect of it.
Cool.
So yeah, those are the ones that I'm listening to right
Oh,
now.
I like it. Yeah, I listen to talking about brain ones. I do the quick brain, the Jim
Mm.
Quick. Yeah, I like him
Mhm.
too. There's a lot of
Mhm.
good ones,
Mhm.
and meditations and such. So that's
Yeah.
cool. It was just a
Mhm.
little info. And then as we kind of wrap up toward the end of the show, but just do you have a mindful way or some information that you kind of want to have so people can reach out to you? I'll have them in the show notes, but anything that you kind of want to share additional to the audience?
Oh, like a mindful way. That's a great question.
Yeah, or
Especially
something that that you want to give to a little tidbit, so that so one, of course, people will reach out to you, but a little tidbit of info.
little bit of info. Wow, I feel that the what would love to have people understand, because I hear it time and time again, I love encouraging people, is that you are not broken. You are not weak. You are not incapable. A lot of people think that they're giving their 300% effort and nothing's changing. And I'm here to encourage you that answers are possible. And what I love about your show and what you're doing and you are highlighting is that there's so many different ways to approach health. And the best way is to integrate that, have collaboration, and see how the best of all the worlds can really help you. So for anyone who is struggling to really understand that if something hasn't worked for you, it is not the last answer. There are answers out there. And just because what you're doing, whether it's through a doctor or a coach or a health professional who's giving you ideas, if it doesn't vibe with you, that's totally fine. We all have unique lives and unique preferences, unique needs, likes and dislikes. And you deserve to find what vibes with you in your life. And it's possible out there. And you don't have to have a restrictive regimen and avoid things forever or have this really strict diet to have optimal health. And so I just want to just share that encouragement with people that it's totally possible to live a beautiful, thriving life with things that serve you, that fill your soul and improve your health. And it's definitely very possible because I've seen it so many times. So I want to encourage people that that's possible.
I love it. I love what I completely think that we need to kind of bring out more of that positivity and thriving, because like you had said before, that stigma of mental health and having some sort of label on something does not
Mhm.
mean that there's something wrong with an individual. That
Yeah.
is kind of the opposite. I think just it's kind
Mhm.
of almost like a flag, and
Yeah.
you're telling people that they can live the best life possible, but you're giving them elements of a toolkit and integrated in some way. So
Mhm.
that's amazing. Is there a way that people can reach you? I'm going to have it in the show notes, but is there something coming up or a way that they directly can get in touch with you?
Yes, definitely the link. I have one main link on my Instagram bio that has a link to a bunch of different resources. So I have a free Facebook community called Defeat Anxiety Without Meds, where I share a bunch of resources. I have guides in that link. My current guide is 7 ways to stop anxiety from spiraling out of control.
Love it.
Yeah, I also have a link to my Banish anxiety method if you want to learn more about that. Links for mental health resources for like POC, LGBTQ, differently abled folks, and links to my medical practice. But to give a little bit, just a blurb of people who are interested in my Banish anxiety method,
Yeah.
it's a 4 phase program specifically for people with anxiety who want to create a sustainably stable future without indefinite medications or exhausting regimens.
I
So
love
I
it.
love to help people through that. So one thing I put together because I understand that medical licenses are unfortunately restricted to state lines. So I can only see patients where my medical license is, which is in California. But my program is a way that I can help people worldwide. So that's why I put it
Oh,
together.
I love it. I love it. So you're able to impact others
Mhm.
in a worldwide range by having that program. That's amazing.
Yes.
So
Mhm.
they're still able to reach you,
Mhm.
and that's great. I also understand the medical license. There's certain patients that I can see, and then
Mhm.
trying to program. So thank
Yeah.
you so much for sharing your insights and all of your knowledge. And I can't wait for those to reach out and have you on the show again. Thank you again for being on the Mindfully Integrative podcast, and we appreciate your time.
Thanks, Dr. Damaris.
Oh, have a wonderful day. And thanks, you guys. I hope you enjoyed the show, and there will be all the information in the show notes. So you guys stay tuned for the next episode. Have a great day.
Bye.